Okay, video time. Here we go. Uh, I don't really have anything planned, but that's okay because that's all I do is unplanned videos. So I'm gonna play on my computer while I'm just rambling to myself, I guess. So we are on week 5 of the new grad residency, and I tried to make a live video a couple days ago. Did not work. Did not work, and I don't know how to fix it. So, and I don't. Again, I don't know what I'm doing, so it's okay. Um, so it's like 8 o'clock right now at night. It's a Saturday, and I just put the babies to sleep, and figure, you know what? No better time like the present. Let's bang this thing out. And so I'm gonna try. I'm gonna try. So how did the week go? It went well. I don't know. I guess I've read a lot of really sad, scary stories of new grads who like don't do well and they struggle and they hate life and this and that, and it's really hard. And it's kind of hard. Um, but it's a lot of fun. I think being a nurse is like super fun. I'm in that, it's everything's new, and I'm just loving working and enjoying my job and enjoying the people I'm working with. I haven't had a single problem up till now. So I don't know. I don't know what I'm doing to make it work. I don't know what the trick is, to be honest. Um, but staying focused, I guess. Staying focused on tasks that you gotta complete, and time management's huge. So what does it mean by time management? I don't know. On my unit right now, you got to get all you got meds at 7 o'clock. You got meds at 8 o'clock. You got meds at 9 o'clock. You got to get your assessments done by 8:30 ish, 8 o'clock. So, how do you fit all that into your day? Or how do you in the morning? I should say the morning seems to be the busiest. By 10 o'clock, if you have all your charting done and you have all your meds passed, it's like a blast and cruise kind of scenario where, okay, 12 o'clock we're gonna recheck, do the next set of meds or whatever. So, I don't know, just I don't know what it is. It's not like it's super difficult. It is challenging. That's what I love about it. It is a challenge to get all those meds passed, and it is a challenge to be able to get in the room. Practicing getting in the room, getting a really good head-to assessment done, checking on needs, addressing plan of care, discharge planning in the morning, kind of seeing where we're at with that, and then all the medications be passed, and then the doctor communications. There's a lot to go over, but it's not impossible. Lots of nurses do it. Um, and it's been really fun. Been really enjoying it. Uh, I'm learning a lot. I'm learning so much. And I'm being able to apply the knowledge that I already have that I'm building upon. So that's really nice. I think one benefit I have is that I have pretty solid foundation of pathophysiology and pharmacology. So I have that in like the back of my pocket all the time. So it makes communication with doctors pretty smooth usually because I know what to address for the most part. I'm not in the dark most of the time about what's going on. And if I am, I get caught up to speed pretty quickly. So, now it's really like, because that's the fun part for me, like all the physiology and the assessments and all the signs and symptoms and all the medications we give. and like why we're giving it in the dosage ranges and like adverse effects and like what to look out for and what the parameters are. I think all that's super fun. So it doesn't feel like work. I like doing like studying all that stuff. So, I'm having to learn to put that kind of on the back burner of like, worrying about that because it's now kind of second nature. So, so now I have to focus on my time management and my assessments and making sure, doing the job, the actual job is what I'm like, really having to focus on. So I'm learning slowly how to do the job. And this is week 5 of the new grad residency. Um, Technically, it's week 4 being on the floor because the first week was all like epic training and orientation, corporate orientation, all that jazz. So this is like the 4th week on the floor, and I took 6 patients for the first time, and it went well. I didn't drown, I didn't sink. My preceptor helped me where I needed it, and I was able to get all my stuff done. He said I did a good job, so I'm definitely on the right track, I think, with what I'm supposed to do. So that's kind of where we're at, I guess. Next week I'm gonna be it's Saturday. I'm gonna start work Monday, so I'm doing Monday, Tuesday, Wednesday, and I'm excited. I really love working at this job. And you know what? I mean, I don't get tired. This hospital system is so great. The CNAs here, they can do a lot. So the CNAs here can DC Foley's, they can do blood sugar checks, they can DC IVs, they can like print out and do all the secretary clerical work. So they are a huge resource, a huge asset for us. And I'm not like running around like a chick with my head cut off, pulling out everyone's IVs on discharge and like I can delegate so much. My AccuChecks, I get a sugar, like someone gets a sugar for me. I don't even have to do AccuChecks in this hospital. So that really helps with time management too, because now I'm not running around, trying to do AccuChecks, trying to get morning, AM meds before breakfast, and doing my assessments. It's just one more thing that I don't really have to worry about. And so that's really, really helpful. Hold on 1 second, I'm going to tell these. So that's pretty sweet, It's I think that's been really helpful with my being able to stay afloat. Is that the resources I have are super super helpful. Let me see here. Sorry, just talking to people. So, yeah, that's kind of where we're at. I don't have any other updates, I guess. One thing I guess I could say, I don't know, what else is going on here? Nothing really is going on that's super crazy. It's been pretty straightforward. I'm enjoying life, man. Enjoying being a nurse. It's a lot of fun. One thing I am finding though is that I like this medical unit a lot, but it doesn't like push me mentally. Like the time management's great, but being on this floor, if my patient gets really sick, I just I gotta send them to ICU. So that makes me really sad because I like taking care of the sick patients. Like if I have a patient on BiPAP, that's not my concern. I want to be concerned about my patient's BiPAP. I don't want to just, you know, have to, pass the buck, if you will. And so I think that's where my heart is like ICU or ER, because I really need that mental stimulation of like really sick patients, because it keeps me really engaged with my patients, and it keeps me on my toes. And if I'm on the medical floor, I don't stay on my toes. I'm like, I get to blast and cruise. Like I do my morning meds, and then, it's like, now I'm just, buying time pretty much. And I don't like that. I don't want to just be buying time until, we discharge them. And I like taking care of them and getting to know them on the medical floor. So it's not like I will just never work medical. I'm working medical now and I really enjoy it. And maybe I'll come back to it when I want to, settle down, I guess. I don't know. But right now, my brain, like, I really want to take care of the really sick patients. I really enjoy that. So we'll see where I land. I'm going to find out where, like, my official, like, home unit is in late November. So right now I'm on a medical floor. In a couple weeks, I will be on a surgical floor. I'll do 6 weeks on surgical, and then in late November, or maybe early November, I don't know, whenever, sometime in November, the positions will open up for the whole unit, the whole hospital, and I'll be able to apply for different jobs. So, wherever I land, I'll be happy, but my heart is in it for like the really critical patients. So, I want to be where I feel stimulated mentally and called. And so we'll see where I land. I'm going to give it a shot. I'm going to shoot for the stars, and, wherever I go is going to be good. I don't know. We'll just see how it is. So, everyone at this hospital has been so supportive, though. So I have pretty high expectations, I guess, for the hospital, because they're so friendly and supportive. So I'm really, I have all the hope in the world for being at this hospital for a long time, because I really, if you're happy going to work and you like working with the people you're working with, you're gonna stay, and that's what I'm learning. I picked a good hospital, and we got a good culture here, and I'm just super excited. So, and I think eventually I want to go in the cath lab, so that's like another bucket list thing. I want to be in that cath lab, I think. I get all excited thinking about it. So, I don't want to, let myself down, or I don't know. I want to live my full potential, and I don't want to just be like, oh, medical's easy or fun. I mean, I don't want to say it's easy, but, it's not like it's pushing me mentally. Like, I'm not having to worry about, I'm not having to interpret ABGs and adjust vent settings discuss vent setting changes based on ABGs. And, we're not running, codes, and we're not, really implementing sepsis protocols. And I really like the, delirium campaign A to F bundle. So, like, implementing spontaneous breathing trials and spontaneous awakening trials, and managing, sedatives, and managing the vents, and managing the pressors. And, I really like that stuff. That sparks me, gets me excited. So that's, if that's where I'm at, that's where I want to be. I'm just going to fight for it as hard as I can. And I also want to keep my options open. Not that, I don't think I'm going to do CRNA, but, I'd like the option open. If I go to ICU and get my CCRN, at least I can go back to school for my BSN. And if I do that and the school, the hospital pays for it, now I'm, I'm in a perfect spot. I was looking at, I think, National University has a CRNA program in Northern California or Central California, and it's like 80 grand. I'm like, dude, I can save up 80 grand and go do CRNA, and they don't require uh, a um, what's it called? Where you got to take a master's program, like a, like an MCAT for a master's program. I forgot what it's called. Uh, Whatever, doesn't matter. So like, there's like a test you're supposed to take um, for master's programs, and has nothing related to nursing. It's like reading comprehension and stuff. Um, and I'm not writing papers is not my love. I don't love writing papers, so I want to do that as little as possible. And I know I'm gonna have to write papers in CRNA school or whatever, but at that point it's gonna be really worth it because as a CRNA, your paperwork. That's what I really like too. Is like your charting is pretty minimal. You're really managing. You're at the bedside managing, not bedside, but the OR. But even at the bedside, if you're an OB and stuff, but you're managing patients. You're doing skills, and it's a very critical position. So maybe one day down the road, when my little kids are a little older and they're in school and stuff, I can go back to school. I don't know for sure, but that's kind of another like pipe dream. And I know everyone wants to do that, so I'm not trying to but definitely not. It's not for sure, only if it's meant to be. So, but it'll start with at least getting ICU experience, and if I get ICU experience or ER experience, I can transfer into the cath lab. If I get cath lab experience, I can scrub. If I can scrub and circulate in the cath lab, oh man, that's gonna be fun, man. That's really gonna be fun. So I'm all for that. That sounds like a blast to me. Um, I'm a little bit, I'm not like a huge fan of working 5/8 every day. But I do like on call. I think on call's fun, and it's not horrible. You wake up, you get up at a good time, you get home at a good time. It doesn't kill you, and then once in a while you get a STEMI in the middle of the night and you get a little adrenaline rush. So that's kind of fun too. So that's kind of my thoughts on that. Um, Hopefully this clicking isn't bothering anyone watching this. I don't think anyone's gonna watch this, but if you made it this far, good on you, man. Thanks, or woman, whoever it is. Thank you. Um, I don't know. I don't know. I guess that's it. Maybe I can come up with a video on tips and tricks I'm learning. As a new grad. Maybe I can do a video on that. Right now I'm just doing updates of and it's not even really an update. Oh, I guess I could add more stuff. The other thing I got to do, which was amazing, was total care. So with total care, that just means you don't have a CNA. So what does not having a CNA mean? It means you get a different ratio. So you no longer have 6 patients. Now you have 4 patients because you're doing all the care. And I was a CNA for 10 years. So, I was taking 12 patients as a CNA. So now I get 4 patients as a CNA and I get to do all my assessments and my meds. Now it's cakewalk, dude. It's freaking great. I love it. I'm 4 patients? I'm that's great, man. I'll take care of 4 patients. And I'll ambulate them and toilet them and clean them and change them. And I can do all that for 4 patients and then pass their meds and do an assessment. I mean, come on, that's no problem. So that's kind of where I'm at. And maybe that's what helped with my transition into nursing is that my background as a CNA was really pretty helpful. I got to learn how to manage my time with 12 patients. And yeah, we're not passing meds and doing assessments, but you're still doing a crap load of stuff. A lot of stuff as a CNA. Especially, and you got literally triple the patient. If I got 12, that means I'm tripled up on 4 compared to 4. So I have 3 times as much, having 12 GI tracts and 12 beds, 12 bladders, It's a lot, dude. It's a lot of stuff to do, a lot of stuff to take care of. So going down to 4 was sweet. I was all for it. So I guess that's it. So all right. If anyone has any questions or comments, feel free to comment. If you like the video, cool. You can like it, but I don't know, whatever. Doesn't change my life any. So I'm just gonna, I don't know, leave me a comment. Tell me what you're thinking. If you're a new grad, if you're an old nurse, if you're, most likely old nurses aren't looking at these kind of videos. But if you're like, sorry, hold on a second. You're thinking about being a nurse, thinking about going to nursing school. Huge advocate. I'm a huge advocate for going to nursing school. It's great. It's hard, but I love it. I loved every minute of being in nursing school. It was fun. I had a blast. And leave me a little comment or something. And that's all I got. So I'm gonna upload this now. And next week we will do our next video. In week 5 of the residency, but week 6 of being employed. So hopefully it all goes well. I'm gonna stay as focused as I can. I'll add some more. So look at this. I'm gonna add a little other thing. So when pulling meds, oh my goodness, is it stressful. Like taking my time, going slow, reading every medication, reading how many I'm pulling, what's the dosage, what's the normal range, is it the right patient, doing my rights, checking all your rights, triple checking all your rights. It's a lot. It is a lot. And to not to take that lightly, or if you just start like as a nursing student or as a new nurse, if you like pulling your meds, boom, 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 and then you just start, boop, you get in the room, you start scanning them, boop, 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 boop. You don't even read them. You don't look at the computer. You don't match the patient's name with the armband, patient's allergies with what it says on the MAR, looking at the medications due at 9 o'clock or whatever time, looking at the medications you have with you, and then boom, scanning each one of them and like actually being conscious about it. Super important, because you can really harm people if you don't. So I guess that's my tip. Stay focused. Practice being perfect with your medications, because we don't want to cause med errors and we don't want to make mistakes. And it's so easy to do that as a new nurse, as any nurse. There's nurses that have been around for 10 years and they freaking make mistakes and it causes somebody to get injured. So that's my tip, I guess. Don't injure the patients. Focus when you're passing your meds. Focus when you're drawing up your meds. Focus when you're administering your meds. That's what I got. All right. That's it.